we have realized is that NCDs will either drag you into the grave or will drag you into poverty. It's a condition where when you have, you cannot completely cure, but you'll have to manage. And so under such circumstances, people virtually sell all their property. So at the end of the day, it brings them below the poverty line. And at the end of the day, they don't even succeed managing them well, and they end in the grave. And so what we are doing at the moment is to establish a fund that will mitigate the effect or, if you like, discount the cost of the treatment of these chronic diseases. As I speak to you now, it is estimated that it costs a patient not less than 50 to 53,000 Ghana cedis a year to be able to manage or to treat a chronic disease. And so what we have done is to establish a fund where we can assist patients to manage or to treat these conditions.
And that is what you launched yesterday. But how would you get funding for this? How would it be funded, this fund?
Okay. So one of the sources of funding is that you recall that under the former regime, the National Health Insurance Fund was capped. So it was capped into the consolidated funds, not being used in the health sector. So now what we have done is that His Excellency the President has uncapped the National Health Insurance. So whatever money that is flowing into the National Health Insurance Fund, we are taking a portion into the Mahama case. Apart from that, we'll be looking at the budgetary allocation into the National Health Insurance. So every year when they read the budget, we expect that government will make some allocation into it. We'll also be looking at corporate Ghana to contribute into the fund. And so the bill has detailed the sources of funding, and there's going to be a statutory body, a statutory fund. So the sources of funding is clearly defined.
When you say statutory fund, it means that it will be state-run.
Yes, it will be state-run. Yeah.
I see. What steps do you need? Because now you have launched it. I guess that's a hurdle that has been cleared. What other hurdles do you need to clear before you get to the point where you can say the fund is ready, I want to apply for it?
Okay, so now what we are waiting for is the MP to come from their recess. Parliament resumes. We push the bill. It's passed into an act. The National Health Insurance formula is approved. The National Health Insurance formula for 2025 is approved. Money is made available. Then we begin the fundraising exercise to also get some money into it. Then we establish the trustee, the secretariat. Then we begin to run so that if anybody wants to apply, number one, you must be a citizen of Ghana. Then you must be diagnosed of the conditions we are talking about. At least 2 medical practitioners must diagnose you of the sicknesses, the chronic diseases we are talking about. And then you apply the Mahama Care application forms. You apply. When you apply, within 2 weeks maximum, you must get a feedback.
And because you're just talking about the process of establishing it, so you have the bill ready.
The bill is ready. Mm-hmm. The policy document is ready.
Okay.
There's a dedicated funding, and these are the processes I've outlined. So we are waiting for Parliament to just pass the bill into an act. We are waiting for Parliament to approve the National Health Insurance. Once the National Health Insurance Formula 2025 is also approved, then the money flows into it. But before then, we'll also start the fundraising aspect. And then once the bill is passed, we can also establish the secretariat, and then we kickstart.
I see. Then what is the professor supposed to do? Because I realized yesterday a professor was given a job. What is his job?
Oh, Professor Aite.
Yes. What's Professor Aite supposed to do?
Oh, no, Professor Aite was the chairman of the Mahama Cares Task Force. They developed the policy documents. And so his job for now has come to an end. And he did a very, very, very good work. Great job done.
I see. Okay, so I thought he was not developing the framework. Anyway.
No. The framework has been developed. I mean, that is what together we launched yesterday.
The interesting thing, when you say, so it means that at some point, for now, is Mahama Cares under you?
Everything under the health sector is under the health ministry.
Okay, so I mean, are you running? Would the ministry be running it?
So for now, we'll start the fundraising aspect. Once the bill is passed into an act, we'll set up the secretariat, and then the day-to-day running of the fund then becomes the mandate or the responsibility of the secretariat. Oh. Just like national health insurance.
Oh, okay.
Yeah.
You just talk about fundraising, because you said there are sources of funding that are coming from national health insurance, the national health insurance levy. But then you're also talking about fundraising, because yesterday I realized my senior colleague Mefa did some on-the-spot fundraising for Mahama Cares. How big a part of the funds that go into the Mahama Cares is funds that are privately raised or people supporting?
Yes, so what we realized was that when we did our survey in developing the policy documents, Ghanaians are willing to contribute to this particular initiative. And we need a lot of money to do more, because as we go ahead, we will be expanding it. Just like the national health insurance when we started, we keep expanding the number of diseases on the script. So as we go ahead, as we progress, we'll be increasing, and expanding. And so we need, for the initial startup, we need not less than 3 billion Ghana cedis. We need not less than 3 billion Ghana cedis, not less than that, to start. No. In fact, at some point in time, we should even be looking at how we can increase the specialists, because we have a vacuum. How we can train more, how we can make those treatments accessible. So, for example, if you have a fund and then you go to some parts of the country and people cannot have access to treatment of these conditions, then not many people can take advantage of the fund. And so what we are doing actually is that it will get to a point where we will also increase the access. And these are all issues of resources. And so we need not less than 3 billion to start with. And we'll be, just like you saw yesterday, people began contributing. And tomorrow we are going to announce a short code. After launching it yesterday, a lot of Ghanaians got through to me, and people are willing to contribute, so that when you have a short code at the comfort of your homes, you can also contribute. We'll be appealing to corporate Ghana, MTN, the telcos, the extractive industry, all of them to come and contribute to this wonderful initiative.
3 billion.
3 billion to start with.
Is what you're targeting?
Yes, for now.
For a start?
For a start.
No, so now give me an idea. How much do you think it will take if you want to support, let's say, virtually everybody who has a non-communicable, or as many people reach to as many of them as possible? How much do you need annually?
To support what?
To support those who have non-communicable disease. Because I recall we've had many stories that were done on the matter of kidney dialysis alone. So
Yes, if we want to cover every Ghanaian in this country, we obviously need more than the 3 billion that I have said, but I do not want to give a figure for now. But we need more than 3, and that is where we are going to. We are heading towards that point where we need to cover every Ghanaian who has such a condition.
I see. Now, then that moves me into another conversation, because now you have a fund that you're working on. There are those who are also of the opinion that why wouldn't you let the NHIS just cover maybe some of the cost of treating or managing these non-communicable diseases? Has that also been on the table?
Okay, so already there are some aspects of the non-communicable disease under the National Health Insurance already. But then, if you put everything on the National Health Insurance scheme, you will collapse the scheme. If you put everything, because the treatment of the non-communicable disease are very expensive. And so if you decide to put everything on the National Health Insurance scheme, you will collapse the scheme. So we have to take some of the load off the scheme and then rake in other sources of funding or revenues so that we can, keep assessing people in these situations.
Now, as minister, you're saying that 42% of the mortality we record as a country is to non-communicable diseases. That for you, how big is it of a deal is it? And aside this, how do you intend to deal with it?
Let me even add that the most alarming aspect is that out of the 43% mortality, most of them are within the ages of 18 to 45 years, the most productive wing of the population.
18 to 45 years.
Yes, that's how serious it is. And so that is why, one, we are rolling out free primary health care so that will deal with the early stages, how you can detect it on time, early, so that we don't get to the complicated stage. So we are moving the healthcare closer to the Ghanaian. So you have a program where in the market you see people with BP apparatus trying to take the BP of citizens. There are people who are walking in the streets who are hypertensive, but they have no idea they are hypertensive. There are people who are walking in the streets who have sugar issues, but they have no idea. So this primary health care will help us train people from time to time, create the awareness, try to sensitize people. And some aspect of the problem is ignorance. People are not aware. Yesterday we had a testimony where a woman who is diabetic came to say that she thought that diabetes is for rich people who, to quote her, people who eat such a, And so we have to also up the sensitization. We have to take it from the primary healthcare level so that we reduce the complications. But even if we don't succeed in controlling everybody's condition at the primary healthcare level and we get to the complication stage, we have Mahama Care there to also help subsidize the treatment of the chronic conditions.
But I'm wondering, is there data on what percentage of our disease burden is non-communicable now? Because now, as minister, you don't have to. It seems your worry is no longer limited to tackling malaria or disease.
No, they are all very, very important. Every disease, everything is very important, and these diseases have been taken care of by the National Health Insurance Authority or the scheme. So, as minister, what you should be seeking to do is those outside the bracket. You must show compassion. You must show the direction. You must find solutions to what you don't have solutions to. But the malarias and what have you are clearly captured. And we are doing everything to manage those ones. There are a lot of programs with regards to malaria and other diseases. But it is a non-communicable diseases that we have to do more about because it's been left off the hook. So that is the direction. His Excellency, if you remember, His Excellency the President during the 2024 general election made these promises, and it is under these situations that he made these promises. So it's not as though because of Mahama cares we are going to ignore or neglect or abandon what we are doing with respect to the other illness or sickness. No, far from that.
Okay, not actually the point of my question. I'm wondering for you because, interestingly, you're not done dealing with the malaria issue,
Yes.
and clearly, when you walked into a problem with cholera.
Yes, meningitis.
Yes, and meningitis. Those are perennial problems. In the meantime, as minister, it seems you are looking at a curve that keeps going up when it comes to non-communicable diseases.
Yes.
So diseases that you manage for the rest of your life, not treat.
Yes. Yes.
And I'm wondering what you intend to do to bring down that curve. But I think you were just explaining about primary health care and education and everything. But I don't envy you at all. I don't envy you at all. But
so now I know. And this ministry is a very sensitive ministry. Very, very sensitive ministry that you need to be on top of the issues all the time. You need to, there is no, what's the word? Resting period. No, you must always be on your heels because there are emergencies almost every day. And so with your prayers and your support, I think that we will be able to manage the sector very well to the admiration of